Good afternoon, everyone. Welcome to this meeting of the Early Childhood Subcommittee of the Ways and Means Committee. We have 4 bills before us today. We are going to be starting with HB 243. And colleagues, the amendments for this bill and a couple others that are on our agenda today were emailed to everybody. If anyone still needs to see copies of those amendments, members of the subcommittee, please let us know. We'll make sure that you get those. So this legislation is the bill from Delegate Corman that has to do with the Young Readers Program. This is supporting nonprofits that are mailing free books to young kids. We do have amendments on the bill. Basically, the amended version of the bill still moves the program into the authority of the state library agency. It also does provide for an increase in funding for the program, although not as much as what came in under the bill. It would be $100,000 increase, and that is a number we have cleared and gotten approval from the Speaker's office. Alistair, am I missing something else in terms of what are in the amendments that are before the subcommittee?
I think the only other thing is moving, I don't know if you touched on this, moving the who administers the program to, you touched on that, sorry.
Yes. Couldn't remember if there was a third piece to what was in the amendments on the bill.
There's a small thing in instead of requiring that the programs have to focus on neighborhoods of poverty, that's beyond their ability to know. They just have to include those neighborhoods in those they serve.
That's right. That was a request from the sponsor of the bill to delete the word prioritizing from the bill. It would still, there's a hope that we would be serving those underserved communities, but there were some concerns raised by some of the groups that administer these programs about specifically prioritizing children in low-income zip code areas of service. There are questions about the amendments. Everyone have those in front of them.
I'm happy to move the amendments, Madam Chair.
I will second.
Thank you. Delegate Mercury North, you don't have the amendment yet?
I don't have it. Yeah, I'm not sure what happened, but I don't have a copy of that amendment. But just to be clear, I'm looking at the original text, so I can visualize what you're saying, but the amended language removes the prioritize and the rest of the sentences, or just the fact that
just the word prioritize.
Okay, just want to visualize that. Okay. I've captured the rest amendments in my mind. So
okay, yeah, and otherwise it is still moving the program to the state library and does provide for some increase in funding for the program. Okay,
got it.
And any discussion or further questions about the amendments? Okay, the amendments have been moved and seconded. All those in favor, please say aye or raise your hand.
Aye.
Okay, that was, just making sure nobody else joined. That was unanimous on the amendments. Is there a motion on the bill as amended?
I motion that we put forth the bill as amended.
Second.
Any conversation on the bill as amended? And Delegate Wilkins, we're on our first bill. This is the Young Readers Program. We just have adopted the amendments on it. All those in favor of the bill, please say aye or raise your hand. Okay, that one passes unanimously. Thank you. Next up, we're going to go to HB 266. This is Delegate Boyce's bill on bronchodilator and epinephrine availability and use. We do have a very substantive set of amendments on this bill based on the testimony that we received at the bill hearing and subsequent conversations I've had with stakeholders on both sides of this legislation. Alistair, do you want to talk about what the bill's posture was as it came in? And then I'm happy to talk about what the amendments do.
Yes, absolutely. So as the bill came in, it amended the existing guidance for the use of epinephrine in schools to include that those who administer the epinephrine have to be trained in a certain manner, added some reporting requirements, and some other items. And it made those same changes both to the public schools who administer epinephrine and the non-mandatory authorized guidelines for non-public schools who use epinephrine. Those same changes were made both for bronchodilators as well. So if a student was appeared to be having an asthmatic attack or an asthma-related event, whether or not they'd been diagnosed with asthma or prescribed a bronchodilator, they were required under the bill as it came in to have a school nurse administer or a trained professional to administer a bronchodilator.
Thank you. And so this was a bill that the committee had passed last year, but I think some new pieces of information kind of came to the committee's attention this year. So we're going in a little bit different direction from what the bill was as introduced and as was passed by the committee in the House last year. So what the amendments do is it will specify that public schools will have to stock the asthma inhalers and have those in place and available for students who have an asthma diagnosis and have been authorized to use one of those inhalers. Each school district would have to adopt their own policy to make sure that that's happening. And it would allow for either the school nurse or any other staff member who's designated by the school nurse to administer the bronchodilator. And then we are also specifying that MSDE and the Department of Health update their voluntary guidelines for schools about management of students who have asthma. The current guidance is 10 years old, and we're specifically calling out that they should take up the issue of differentiating, is it an asthma attack versus anaphylaxis in response to a food allergy, to help school personnel decide what to do in that kind of emergency situation. So they are fairly robust amendments. Let's see if there's questions. And I will say that we do have some stakeholders who are on the call if there is any questions to direct to them. Yes, Delegate Ebersol.
Sorry, I could have raised my electronic hand there. Sorry about that. So just to be clear, because I think I remember this correctly, but we did go back and forth a lot. We have asthma, or what are called bronchodilators, and we have epinephrine, which is for anaphylaxis. And one is more dangerous if it is administered on an incorrect diagnosis than the other. And I forget which now. Do we know, and is it relevant to what we're asking to have happen here? So I don't know. I'm going to ask Madam Chair if you think that's a relevant question at this point, and then if it is.
Yeah, that would be fine. And I see that Robin Elliott, who represents the school nurses, is on the call if she wants to answer that.
Sure. Thank you for that question. So neither bronchodilators or epinephrine have side effects in and of themselves. What the issue has been is if a child is in respiratory distress and we don't know if it's asthma, the protocol is that they get an EpiPen because they could be an anaphylactic shock. And so the bill is now consistent with that clinical protocol, that we make sure that in the cases where it's unknown, that the EpiPen is provided. And so to make sure that which by the way, treats kids with asthma as well. And so we know that that's the protocol for MEMS and many other sort of medical settings.
And so, if I may, Madam Chair,
Sure.
so you're saying that in a case where someone is unsure if it's anaphylaxis or if it's asthma, that administering the EpiPen wouldn't be significantly dangerous in that situation. Is that, did I summarize that pretty well?
Yes, it's not dangerous at all. EpiPens are very safe. And so the protocol is and easy to administer, even for non-clinicians can be trained, easy to administer. And then the protocol is to call 911. And so you have immediate follow-up. So whatever the child has, you have immediate follow-up care, whether it is indeed turns out to be anaphylactic shock, or if it's respiratory distress because of asthma or for any other reason.
And the inverse of that is not true, right? That administering a bronchodilator to someone who was actually an anaphylaxis would not give the result you want or possibly be dangerous. Is that right? If you misdiagnosed or misunderstood.
That is correct, because the bronchodilator could mask the symptoms. The child could be in anaphylactic shock and actually delay getting the EpiPen. And that puts the child at risk.
Okay, thank you. Thanks, Madam Chair.
Yes, thank you for those questions. And I'll say that what we just heard was consistent with the testimony that we had received. We'd gotten written testimony from the Department of Health, the State Board of Nursing, and the state's Institute for Emergency Medical Services Systems that were part of the bill file for this, that were consistent with those answers, and hence why 2 out of those groups did oppose the bill as it was presented before us, and Department of Health had informational testimony that raised some concerns. Other questions on the amendments? Delegate Miracle North.
Yes, just to be clear, and thank you, Madam Chair. To be clear, I'm looking at the first part of the amendment in terms of striking the administer and training. Can you just clarify for me why we're not training personnel? Is because the nurses are going to be designating those individuals, or I'm just trying to understand why that was struck.
Yeah, my understanding is that right now nurses have the ability under their license to designate other personnel to administer medications. And so I'd be happy for Ms. Elliott to speak more to what the current standard is, not just specific to kids who have asthma, but for all medications.
Yes. So in existing law, in the Board of Nursing's law, school nurses are permitted to, and routinely do, they're permitted to train and delegate to non-clinicians, so teachers, administrators, coaches, to administer emergency medications of all types. And so what that school nurse does is, one, make sure that that teacher, one, is comfortable doing it. They do training and they determine whether or not the teacher or the coach is indeed competent, and then they get designated. And that is really, really key for all emergency medications, including bronchodilators, because if you can imagine that the school nurse, even if present, may be at the other end of a school, or the child may be on a field or school trip. So this happens very routinely, where school nurses are delegating the administration of these types of medications within the school, so that the child can participate in all those activities safely.
Thank you.
Other questions or conversation on the amendments? If not, I do need to offer one amendment orally here on the fly, just to make a very slight modification for those who are following along in the amendment. It is on page 8, where it talks about the reporting requirements for public schools to report on the number of incidences that required the use of a bronchodilator. We just want to specify and add the word stock, so that it's not the kids who are self-carrying that the school's being required to report on that. They don't need to do that now. The self-carry is already authorized, or that this would just be specific to stock bronchodilator use. So I'm going to offer that to be voted in terms of along with the amendments that are before us. So if there isn't any other further questions or conversation on the amendments, is there a motion?
I'll move the amendments, Madam Chair.
Second.
Any further discussion? Okay, all those in favor of the amendments, say aye or raise your hand.
Aye.
And that was unanimous. Further discussion on the bill as amended. Okay, is there a motion?
Move the bill as amended.
Second.
Okay, all those in favor of the bill as amended, please raise your hand or say aye.
Aye.
And that one is also unanimous. Thank you all. Looking at the time, I think we can maybe get through one more bill. We're going to take up HB 206, which is Delegate Ivy's bill regarding Montessori schools and enabling them to participate in the pre-K expansion grant program. Alistair, do you want to talk about the posture of the bill as it came in?
Yes, absolutely. So just for some background information, as part of the blueprint for Maryland's future, the state is switching to publicly funded pre-K for provided for low income and potentially other students if Chair Atterbury's bill passes from yesterday. There are certain requirements that must be met in order to receive funding from the state for those students. One of those requirements is that there's a certain staff to student ratio in the classroom. That's based on the pre-K students being ages 3 and 4. But in the Montessori context, students are mixed in ages. They range from maybe as young as 2 through age 6. So Montessori schools, therefore, are not eligible for funding under the blueprint as it exists. So the bill as it came in would alter that requirement as it pertains to the ratio of students to teachers. If there were students, instead of a 1-to-10 ratio, it would be a 1-to-15 ratio if the students were age 5 or older. But there are some amendments, I think.
Yes, and the amendments, thank you. The amendments were just sent right before the meeting, Delegate Ebersol.
Thanks, Madam Chair. So we had a bill like this last year, just for perspective, and that one changed certification requirements, right? So this one goes to funding then in this case, is that correct?
So last year, the General Assembly passed a bill authorizing certain teachers to to get certified as Montessori teachers if they met certain Montessori certification requirements. That's also in this bill, I should have mentioned. In addition to the requirements of student to teacher, there are also requirements that teachers have to meet certain certification standards, including that they hold a bachelor's degree and are, if not trained in early childhood, are pursuing training in early childhood. This adds an additional requirement that if you're a Montessori school, you have to have a bachelor's degree and be certified by one of those same certifying institutes that the bill from last year authorized as certified teachers.
So I'm just trying to follow because it was signed into law. So it's more restrictive or less restrictive than it was last year in terms of letting people be certified in a Montessori setting.
It's identically restrictive to that bill. I'd say it's probably more restrictive compared to other entities eligible for the blueprint.
So I'm sorry, since it was law, what are we adding on here? It was made
So
law.
what was law was just that what was enacted last year was that Montessori teachers are authorized to be certified in the state.
That was it.
That does not pertain to their being able to receive funding through the pre-K expansion grant or the publicly funded pre-K sections of the blueprint.
Clarifies it. Thank you, Madam Chair. Thank you, Alistair.
Certainly. And I'll just note for our stakeholders, typically we don't let folks weigh in unless there's a question specifically that we'd like the advocates to address. So the amendments that were sent right before the meeting were something that we worked out with the bill sponsor, and it basically addresses the allowable ratio of students to personnel, as well as what the education and certification requirements are for teachers at a Montessori school, because those were two provisions right now that have been barriers to Montessori schools participating. We did receive some testimony to those points at the bill hearing, and hence the amendment to try to adjust those ratios slightly. So Alistair, do you want to talk about the amendments?
Yes, absolutely. So the amendments do not change the bill too much. They just specify that if the Montessori school is only serving 3 and 4-year-olds, they must maintain that same ratio that other publicly funded pre-K eligible schools have of 1 to 10. However, if they also include 5-year-olds or above, they have to maintain a ratio of 1 to 14 and not more than 28 students per classroom. And
so
additionally,
sorry, if I can just jump in and just say, so basically on that point, we are giving more flexibility than what's in statute now for the pre-K grant expansion program to recognize that Montessori schools do have mixed age classes and allowing them to have a higher student to teacher ratio than what's allowed under law now, but it is lower than what was in the bill as it came in.
And additionally, the bills that came in only required that those teaching in Montessori schools be certified by those three groups that we allowed state certification for last year. The amendment also requires that you hold a bachelor's degree and be certified by one of those three groups.
And one more question, if I may, Madam Chair.
Please.
Thank you so much. So I remember too that I just want to make sure we haven't voided this, that people who are certified by these exceptions are certified to teach in a Montessori setting, but it doesn't automatically make them certified to teach in other preschool settings. They'd have to complete the general state requirements in those cases, right? Okay, that was a yes or no, and I got a nod of the head. That feels great. Thank you.
Other questions or discussion?
Are we?
Okay, is there?
I wanted
Go
to
ahead.
move favorable on the bill.
On the amendments, yes. Thank you, Delegate Wilkins. Is there a second?
I'll second that.
Okay, all those in favor of the amendments, please raise your hand or say aye. Okay,
Aye.
that is unanimous. Is there a motion on the bill as amended?
Move favorable on the bill as amended.
Second.
Any further conversation? Okay, all those in favor, please raise your hand or say aye. That
Aye.
is unanimous. Thank you, colleagues. I will note that the fourth bill that was on our list, HB 525, which is Delegate Guyton's bill to establish a pilot program for outdoor preschools, we were just going to discuss today. So colleagues, if you have thoughts on this particular bill, I would love to hear from you. We don't have time, I think, to have a full conversation today, but we are working on some amendments to this bill. So if you would like to weigh in on that, please catch me. I think that is it in terms of our agenda for today.